All right. Welcome, everyone. Thank you all for being here this evening. Um, uh, the props that we need today are a little less than normal. You could have a couple of blocks. They might help in some of the transitional movements that we make. We will also be doing a supported bridge at the end of the practice where you might want to block. If you have a yoga bolster, that works too. A foam roller will also work for that position. And a folded blanket will too. I'm going to use a folded blanket when I'm in hands and knees or knee down lunge positions just to pad my knees. And we are going to start and end the practice with the hip flexor relaxation positions, which is like legs up on a couch, legs up on an ottoman or a chair. So I'm going to show that with my two yoga bolsters here. So the practice today is about the hip flexors. And in rowing, you need to be able to engage the hip flexors, but also to be able to turn them off. And for restorative reasons and recovery, you need to be able to lengthen, stretch, and relax those muscles as well. So we'll talk about when it's appropriate to activate, when they should be deactivated, what are some good gentle stretches and relaxation positions you can do for your hip flexors. And I will tell you a little bit about the anatomy and how they work as we go along. But first, let's go ahead and get started. So we'll be starting on our backs with the legs up on the chair, the couch, and you could be moving off of your mat to come into this position. We're just going to be in some stillness here, and then I'll give you a moment to transition away from it if you want to come back onto your yoga mat. So we have our hips and knees bent, and it could be up a little bit higher where that degree of bend is more at like 90 degrees, but it doesn't have to be 90 degrees for you to get the relief, the relaxation here of the hip flexors. And the bonus of this position is it also decompresses your lumbar spine, so it creates space between the vertebrae and the lower back. So it takes pressure off of the discs and off of the joints at the back of the spine there as well. And we'll be here in some stillness for a couple of minutes, so you don't need to see me. You could close your eyes if that feels good, or just bringing a soft focused gaze up towards the ceiling. And here at the beginning, bring your attention to your breath. So yoga is a mindfulness practice, and as you hear, I encourage you to listen to what's going on in your body. But sometimes it's hard to listen to those signals if your thoughts are elsewhere, not in the present moment, not in this room, not on your mat with you. If we can stay focused on the breath, that's going to help us stay anchored in this moment, as opposed to what happened earlier today or last week or last year or what might happen later on. So start breathing through your nose and start to slow your breath down. Lengthen out both the inhale and the exhale. It's not big, deep breaths. It's not big and effortful. We're just slowing down, lengthening out the breath. And that little bit of attention that it takes for you to slow down the breath is going to help to keep you anchored in the moment. So this is the breath that we're using throughout the practice. Continue practicing the breath here as I talk about the hip flexors. So you have 5 hip flexor muscles on each hip. They all attach somewhere on your thigh, the bottom end, and then some of them come up and attach to the front hip bone. It's really part of your pelvis. And 2 of them go deep in the belly behind your lower abdominal organs and attach to the bottom 6 vertebrae of the spine. So the muscles are hip flexors. They pull the thigh up towards your belly, but they can also tilt the pelvis and the spine forward when the lower leg is anchored. So we'll see both of these movements today. In this position, we've put all 5 hip flexors, all 10, count both sides, in a slackened position so they can relax. This is the off switch for your hip flexors, meaning they're neither being stretched nor are they being contracted or engaged. So a lot of times when my clients have issues with their hip flexors, holding tension in the hip flexors, I have them do this pose for at least 90 seconds, 4 times a day. It's easy to do, the 4 times a day is the hard part. Take the next few breaths to set an intention for your practice. And it could be the reason you've shown up today. It's about releasing tension or about recovery, cross-training, making yourself a better rower, preventing injury, or just because it feels good to you. So bringing this thought, we're setting it here at the beginning. We're going to remember it throughout the practice. Your reason for showing up, keeping it in mind throughout the practice. Bring it to the front of your mind here and breathe. So we're going to come out of this position. So if you've scooched over to the couch or whatever, good roll over and move yourself back onto your yoga mat. I'm just going to push these bolsters here out of the way and saving them for later. I'm going to do that for my relaxation pose and then come back onto the mat here. You're on your back, so you're face up, and you're having your knees bent and the feet flat. And we're going to start with this pelvic movement. So remember, I said the hip flexors can also tilt the pelvis forward or tip the pelvis forward. We're going to do backward and forward tipping or tilting of the pelvis. The backward tilt first is where we flatten the lower back into the floor, tipping the tailbone towards the ceiling without lifting the hips. And then go in the other direction. We tip the pelvis forward, press the tailbone into the floor. The low back arches away from the surface. And we're going to go back and forth between these two, flattening the low back into the floor, tailbone up on the exhale, pushing the tailbone into the floor, arching the back away from the floor on the inhale. Exhale, flatten, tailbone up. Inhale, arching that back, tailbone into the floor. A few more. You're going to see this movement in several different positions. And you probably don't feel your hip flexors making this movement into the forward tilt here in this position. In fact, if you want to feel, you can put your thumbs or your fingers just below these front hip bones. And because our hips are bent, our hip flexors are slackened and relaxed. So this movement is happening by the abdominal muscles to flatten the back and the low back muscles to arch. But we'll see this in a different position, and you'll feel those hip flexors working too. We'll come back into center here, just relaxing, rocking the knees gently side to side. And pull the knees in towards you and circle the hips and knees here, releasing through the lower back. And circling in the other direction. Because 2 of those hip flexor muscles attach to the bottom 6 vertebrae of the spine, sometimes hip flexor tension is manifest mostly as low back pain as opposed to hip pain. All right, bring this back into center. So we're going to come up to a seated position. If you have some issues with your lower back or osteoporosis, I would suggest rolling to your side and pushing up. If not, you can hold onto the backs of your thighs and start to rock forward and backward along the length of your spine. And you could use a little momentum here. We're going to do maybe 3 or 4 rocks, and then eventually come up to a seated position. So I'm just scooching back to the middle of my mat. So I'm going to sit here with the knees bent and the feet flat. And just to give myself a little bit of room, I'm going to walk my feet to the outer edges of the mat so their feet are a little wider than the hips. Hold on here either to the shins or the backs of the thighs. And we're doing that pelvic tilting motion we just did on our back. So that backward tilt, we're going to let the tailbone tip forward. The pelvis is tilting back, so belly button towards the spine. That low back rounds here. And then tip that pelvis forward. So push the tailbone back, belly forward, chest up a little bit. And we go back and forth with those. So tipping that pelvis back on the exhale, rounding the lower back. Pressure is behind the sitting bones. And then inhale, tip the pelvis forward, pressure onto the sitting bones. And go back and forth with that a few times. So not as big of a cat-cow movement of the whole spine, isolating more at the pelvis and the lower back. And if you're holding on here with your hands, you're helping those hip flexors out a little bit. If you want to feel the hip flexors working with this, you could, again, find the area right below those front hip bones. And as you tip that pelvis forward, you might feel those hip flexors engaging, and then they relax as you tip backward a little bit. So hip flexors having to engage a little bit to tip that pelvis forward. All right, pause here, lean back on your hands, stretch your legs out, and just shake them out a little bit. We're going to do that one more time, that pelvic tilting motion right here, but with the legs out straight. So this is going to be similar to where you are in the finish position, right? So the legs will be straight. You'll be in probably more of a leaning back position, but for the purposes of this, we're going to sit up a little taller. You can have your hands here to help at your sides and do that same rocking or tilting of the pelvis. We're going to tip that pelvis backward, belly button towards spine, and then tip that pelvis forward, low back arching belly forward. So we exhale, tip that pelvis backward, inhale, tip that pelvis forward. So when we tip backward, we're pressure's behind the sitting bones, we tip forward right onto them. And again, if you want, you can press just below those front hip bones and you'll feel those hip flexor muscles engaging to tip the pelvis forward. So hopefully you're not in that rounded back position at any time. The spine will be a little bit more straight, be leaning back, but you're using your abdominal muscles and your hip flexors to bring you forward as you come out of that finish position. Going back towards the catch. All right, pausing here, lean back on the hands again, bend the knees, bring the feet out a little wider than hip distance apart, and just gently rock those knees side to side. Releasing a little bit through those hip flexors. And making your way onto hands and knees. Maybe you're padding those knees here, knees under hips, wrists under shoulders. Option here for hand position could be loose fists instead of that flat palm, or forearms on the floor or on blocks, taking the pressure completely off the wrist. And from here, we're going to do some hip circles. So we'll bring the hips out towards one side and then towards your heels, and then bring the hips to the other side and forward again. So you inhale the hips to one side and back. Exhale the hips to the other side, forward, moving here with the breath. And depending how your back, your hips feel, Your circles might be smaller or they could be a little bigger if the stretch feels good. Hips closer to heels, ribs pushing out to the sides. Pause at the top in reverse directions. And eventually coming back into this tabletop, that hands and knees position here. Walk the knees out a little wider than your hips, just to get a little more rotation, a little more movement in the spine. We're going to bring the left hand behind the head. On the inhale, bring that elbow up towards the ceiling, looking in that direction. Exhale, elbow towards the opposite wrist. You could bend that supporting elbow. Inhale, elbow up. Exhale, rotate it across. A couple more here. And then we'll bring that left hand down. Switching sides, right hand behind the head. Inhale, elbow up. Exhale, elbow towards opposite wrist. 3 more. Getting a little movement there in that mid and upper back. And we'll bring that hand back down here. Walk the knees back in so they're under your hips here to start. I'm going to activate the core a little bit in this hands and knees position. So walk your hands, or if you're on your elbows a little bit forward of the shoulders. Firm your belly, make a solid wall of the abs. Lengthen that spine, tailbone and top of head reaching away from each other. And on the inhale, shift forward here into this knee down plank. So think straight line from knees to top of head. And then exhale, pull the low belly in to bring the hips back. So we inhale, shift forward, lengthen out here, knee down plank. Pull that low belly in to pull the hips back. A few more here. And you'll notice I'm cueing that low belly engagement, low abdominal engagement to pull the hips back. As we pull the hips back, that is hip flexion. But we are not really using our hip flexors. We're using our abdominal muscles to shift back, right? So bending there, hinging at the hips. So thinking about a similar position where you're leaning back at the finish, you got to engage those lower abdominal muscles to start to bring that torso into more upright, and then the hip flexors engage also to tip that pelvis forward. All right, bringing this back here to hands and knees. I'm going to come into either child's or puppy. So either you're bringing your hips over your heels, forehead down for child's pose, or puppy, hips over knees, forehead down. And you could bring your arms in closer instead of reaching them out far away if that feels good to you. You might use puppy instead of child's if you have some osteoporosis or herniated disc in the back, or if it feels better on your hips or knees. Both of these poses, we have slackened the hip flexors. So they are, again, in the off switch position. They're neither being stretched nor are they being contracted here. So another pose to release tension in those hip flexors. And it's a nice counter to what we've been doing where those hip flexors are engaging. So giving them a rest. Because we want our hip flexors strong. We want them to be coordinated, engaging in the part of the stroke that's appropriate. But we don't need them holding tension all the time. You could stay here longer in this hip flexor relaxation position, or coming up here to hands and knees when you're ready. And from here, stretching one foot back, tucking the toes under. Here's our toe rocking motion. Shifting forward, bending through the toe joints, pressing that heel back, half stretch. Inhale, shift forward, toes bending. Exhale, heel back. And a few more, shifting forward and back. We'll lower that knee down, switching sides. Lower that knee down. So I'm setting us up for down dog. And I know down dog can be a challenging pose for many different reasons. Remember that puppy pose is basically a kneeling down dog. You could even reach your arms forward and get that shoulder engagement if you'd like. You could always lower the knees and come down from that child's pose, resting at any time during the practice. Hands forward of shoulders a bit. Lift those hips up and back. Find the length in your spine, even if that means bending your knees a little bit here. So I'm feeling a lot of tightness in my hamstrings and calves today. So I'm going to bend those knees a little bit more, push the sitting bones up and back. And then finding some movements within the down dog that would feel good. It could be pedaling the feet or rising up on the toes, releasing your heels. A little wag of the tail or swivel of the heels side to side, shake that head out. Lots of different options here, depending on what feels like it needs more openness or length or space in the down dog. Settle into this pose. Looking forward, we're going to step the left foot between the hands. And it may not get there in the first go round. You could lower that right knee, left hand helping this forward. We're all going to lower this back knee here. And take your time, maybe using blocks to transition or hands on that thigh to lift yourself into this upright lunge position. And we are going to stretch our hip flexors here. So remember I said how the top parts of the muscles either attach to these front hip bones or go through the abdomen and attach to the spine. So if I go into a big hip and knee bend, but my low back arches and my pelvis tips forward, I don't get much hip flexor stretch. I get a lot of spinal compression. So if I start from that upright position and position my pelvis here, I'm actually going to come into that backward pelvic tilt. So I'm tipping that whole pelvis back, tucking my tailbone under. And just by doing that, I feel a lot of hip flexor stretch on this right side. I don't really need to go much further here, but if you're not feeling much, keep the pelvis tucked under and bend that left knee a little bit more. And then you're not in that C shape, hopefully not in that C shape position of the spine. Pelvis stays tucked under, but you reach the crown of the head up towards the ceiling. Breathe. We're doing this from a knee down lunge position. You could do this from standing, where you have that front foot up on a step or a bench, a chair. So if you wanted to do this hip flexor stretch, say when you got off the boat, you could do it from standing and you wouldn't have to get on the ground to do this. All right, we'll bring both hands down to the floor around the front foot. We're stepping this all back into a plank. You could lower the knees or keep them up. We're going to lower all the way down to the ground. And a cobra from here. So shoulder blades towards the spine and the back waist to lift the head and chest. That's low cobra. That might feel great to you today or better than the bigger pose. Or you could make it bigger, back bend, pressing up, chest forward. Tuck your toes. It's the lower abdominal muscles like we did going from that plank to hands and knees. Pull the low belly in to push your hips up and back. So we go into hip flexion, into that down dog, but it's our lower abdominal muscles getting us there. Long spine, a few more movements, shake the head, pedal the feet. Looking forward, right foot between your hands. You know where we're going here. Lowering that back knee. Take your time, there's no rush. Finding your balance into this upright lunge position. So when those hip flexors are tight, typically what I see in my PT clients are the pelvis tip forward, low back, big arch, no core control, because you can't when those abdominal muscles are stretched out. So we're going to tuck that tailbone under, we're tipping that pelvis backward. So you might start to feel that stretch in the front of the hip and thigh. I'm not as tight on my left side, so I'm going to bend my front knee a little bit more, keeping my pelvis tucked under. And then I start to feel it up into my abdomen, the stretch. So those are those two deeper muscles, the psoas and the iliacus, two of those 5 hip flexors. I get the stretch, top of the head reaching up. Breathe. And we'll lower both hands down around the front foot. This time we're stepping our back foot to the front foot to find a forward fold. Listen for your options here, different reasons for the options. Could be the ragdoll version, knees bent, upper body draped over lower body. Or if you're really tight in those hamstrings, if you've got some issues with the lower back, bone density, or herniated disc, do this version, feet wide, butt back, forearms on your thighs. So you're still folding from your hips. We're still in hip flexion. Either of these poses, you could sway a little bit. Both of these poses where the hip flexor is also turned off. This is the off switch position again for the hip flexors. If you're in the ragdoll, you've got a few more options of holding elbows, a bigger sway. You could shake that head out, releasing tension around the neck and shoulders. If your hamstring is really tight in these standing forward folds, sometimes, not always, but often the hip flexors are tight and tipping the pelvis forward. And your regular standing position is a hamstring stretch because the pelvis is tipped forward. All right, bend the knees a little, look forward, strong legs are rising up to stand. Take a couple of backward shoulder rolls from here. I'm going to move the blanket out of the way. So we've done that pelvic tilting. And if you're struggling with kind of the imagery and how to move that pelvis, if you think about the pelvis, this bowl-shaped kind of bony ring here around the hip area below the low back. If you think of it like a bowl of cereal or bowl of soup, we want to keep that bowl level. Well, we're going to be tipping it backward and forward here from standing. So bring your feet out to, normally you want to keep that bowl level. Bring your feet out to yoga mat distance apart, put a little bend to the knees, and we're going to do that backward and forward tilt of the pelvis. So tilting the pelvis back, we're going to tuck the tailbone under. So this is like that bowl of soup is now spilling out backwards. And then we tip the pelvis forward. So tailbone goes back, belly goes forward. Now our bowl of soup is spilling out forward. And go back and forth here a few times. So notice I'm not rounding and arching my upper back. My head and my shoulders are staying in relatively same position. And I'm isolating this movement at the pelvis and the lower back. The lumbar spine is flexing and extending here as well. So getting that feel for moving that pelvis somewhat independently of the torso. Bring it back into center. Come on up. Roll the shoulders. Maybe shake out your legs a little bit. We're going to come back into that position. So we're going to put a tiny bend to the knees and then do that just a couple of times, that backward, forward pelvic tilt, where you spill the soup out behind you and you spill the soup out forward, and then find where it's level, where the soup is not spilling, and reach the crown of the head up towards the ceiling. And you'll feel there's a little bit of core engagement. These abdominal muscles wrap around your waist. Straighten the legs. Get tall. Relax the shoulders. Bring those feet in under the hips. Notice how strong and stable you feel here. We're going to come back to this in a couple other positions. Just gaining the control of the pelvis. And then let it go. Shake it out. Roll the shoulders. Come on up to the front of the mat. Take a big to medium step back with this left foot. We're coming into crescent lunge. So notice this is very similar to that knee down lunge we did. And you could always lower the knee here if that feels better to you. It could be back heel up or shorten the stance back heel down. So again, hip flexors could be changing your position. If this left hip flexor is tight, it's going to tilt that pelvis forward so the soup is spilling out the front. We've lost our core control. We've compressed through the low back, big banana arch in the low back. See if you can level that pelvis. Don't let the soup spill. And it might mean bending that back knee a little bit to get that pelvis level. And then reach the top of the head up towards the ceiling. Breathe. So you might be getting a hip flexor stretch here on that left side. You're working the core to keep that pelvis in the level, the soup bowl level position. If it feels good, let the arms float up, palms face each other. Relax the shoulders. Release the arms, step it forward, shake out your legs, roll the shoulders here. We'll do this on the other side. So right foot stepping back into that crescent lunge. Front knee bent, hips are square to the front. You could always lower the back knee here if you'd like. So my right hip flexor is tight, and if I'm not conscious of it, then I go into that big banana arch in the low back. My pelvis is tipped forward. I've lost my core control. So I'm going to try to level that pelvis, level the bowl of soup. You might have to bend that back knee to get there. Reach the crown of the head up towards the ceiling. Maybe you feel that core fire up a little bit here. Breathe. You could stay with this or let the arms float up, shoulders relaxed. Taking a few breaths here in that level pelvis position in the lunge. Maybe you're getting a little right hip flexor stretch here. You're going to let the arms come down, step it forward, shake it out, roll those shoulders. All right. So coming into balance pose here, you might choose to step off your mat. A less squishy surface can make the balance part of this a little less challenging or make it you more successful. Could always have a hand on the wall or a steady piece of furniture. So this one we're bringing one foot forward, spread those toes out, place them down, spread out. Shift your weight onto that foot. The other foot's going to come. We're starting in this kickstand version. So I have my toes down here. Focus the gaze on the spot straight ahead and lengthen that spine, tailbone down, top of the head up. We want to keep that pelvis relatively level here, that bowl of soup level. You could stay with the toes down, or you could lift the knee up. Maybe you hold on here at the top of the shin, or even hold on both hands on the back of the thigh. You can turn this into a big toe balance, middle and index finger grabbing that big toe and bring the foot forward. I'm going to stay in the bent knee position because it really deranges my spine here. So try not to let the weight of the leg pull you down. Breastbone stays up. The crown of the head is up. And then if you can, bring that leg out to the side. You might still be in a kickstand version with the knee out to the side. Breathe. We're going to bring it back into the center. Now, if you can, try to let go, but keep that knee up. So we're using our hip flexors, we're using our core. Are you breathing? And then let it go. Shake out the legs, roll the shoulders. We're going to do this on the other side. Foot forward, spread the toes, shift your weight onto that foot, kickstand of the other. So toes are down, the knees bent, my heel is up. Set it up, focus the gaze, find that length, pelvis level. You could stay with this or maybe play with picking that foot up. Maybe you reach down and hold onto the shin or hands hold the back of the thigh. Try to keep that breastbone lifted. The crown of the head is up. Breathing. You could stay here or bring the knee out to the side. This makes us have to shift a little bit more, right? More weight going off to the one side. Trying to shift our center of gravity more over the standing leg here. Bring it back into center if you can. You don't have to, but maybe you try letting go. Hip flexors holding this leg up in an isometric. Don't let it pull you down. Breastbone lifted. Relax the shoulders. Breathe. And then let this go. Shake it out. Roll those shoulders. So I was talking briefly before about hip flexor tension causing you to feel like your hamstring muscles are tight. So if the hip flexors are holding tension, they're going to tip you forward, tip that pelvis forward. Our bowl of soup is spilling out the front. This lifts our sitting bones because they're on the back of the pelvis. The sitting bones are where all three hamstring muscles on each side attach. So when my pelvis is tipped forward, my hamstrings are already stretched. And then if you try to go into a hamstring stretch, well, you're starting from a stretch and you go further because you're in that tip forward position. So sometimes getting that pelvis level actually helps with some of the hamstring pain or hamstring tendonitis you might have there. So we're gonna make our way down into a seated position here. I'm gonna use my blanket to elevate my hips. And this actually helps tip my pelvis forward a little bit. So without it, and relax, I'm more in that C-shaped position. My pelvis is tipped back, the soup is spilling out the back, my weight is behind the sitting bones. I want to be able to sit up a little taller, which I can do, but I'm having to engage my hip flexors pretty hard to be here. So I'm going to elevate my hips. The sitting bones are right behind that folded edge of the blanket, and this starts to tip my pelvis forward mechanically from the outside without me having to engage my hip flexors quite as much. And I'm going to bend my right knee, sole of the foot, coming to the inside of the other thigh. I'm going to turn to face you now. And you could stay right here with this, hands by your sides, lengthening up. So you might already begin to feel a stretch here, or coming into a forward fold. So I'm going to bring my left arm out to the side, kind of the kickstand. Right arm is coming across to reach and hold on to the outside of the knee, the calf. Maybe you get the foot here. Doesn't matter what you get. Lift that chest and look over the left shoulder. So you might be feeling hamstring stretch, back of that left thigh. Also, hopefully you're feeling some right low back stretching here. Those deep hip flexors, the ones that attach to the spine, two of them, they come up and attach to the bottom 6 vertebrae of the spine. There's a muscle in your low back called your quadratus lumborum, and it runs between the bottommost rib and the top of the pelvis. But it also attaches to the bottom 5 vertebrae of the spine. So often if the hip flexors are tight on that side, that quadratus lumborum can also be tight. All right, we're going to come back up. So hopefully you're getting a stretch there with that one. Switching legs, so that right leg goes forward, bending that left knee, sole of the foot to the inside of the thigh. I should have said on the other side, but if you struggle in this position, you can always place a block under that knee here for support. Hands by the side, sit tall. This could be as far as you go, depending on how tight you are. Or hinging forward, this right hand's coming out to the side. Left arm is crossing over to get to the outside of the knee, the calf, maybe it's the ankle or the foot, but if you don't get very far, it's totally fine. It's where you feel that stretch that's important. Lift the chest and then look over the right shoulder. So we're not just folding forward, we're adding this little bit of twist. Maybe you're also feeling that in the left low back, that left quadratus lumborum. And that's a mouthful of a muscle name, so it's also called the QL. Breathe. All right, we're gonna come on up here. Both legs out, shake your legs out a little bit. And coming on to hands and knees, a little bit of core work. We've been talking a lot about the hip flexors and the activation, the deactivation, the stretching of them. But the core muscles in conjunction with the hip flexor engagement is very important at the finish and then as you move from the finish back towards the catch. So we're going to do a little bit more here with the core. So I'm coming to hands and knees, and you could be on your forearms. And we're doing a bear crawl, or in yoga, we call it a floating table position. So tabletop is right here, hands and knees, firm the belly, long spine. You could stay with this and just work on engaging the core, or tuck the toes under and lift the knees. They're floating, they're hovering just above the floor. And notice how you're having to keep that core engaged, working your quadriceps a little bit. And then we're going to lower the knees, untuck the toes. Maybe a few wags of the tail or a few cat-cow motions here. Let's try that again. Neutral spine, firm the belly, lengthen tailbone and top of the head away from each other. Tuck the toes, lift the knees. You could stay right here breathing. You could lower the knees and rest, or you could walk the hands forward, come into a plank, and then walk the hands back, come into that bear crawl or floating table. So we inhale, walk it forward, plank. Exhale, walk it back, floating table. Let's do two more breaths, or lower your knees and rest. Lower both knees. Find that child's or puppy pose. Take a break. Coming back to your intention for the practice. You could stay there longer resting if your body's requesting more rest, or come onto your side. We're setting up for a quad stretch. So supporting the head here, either with the arm or slide a folded blanket or a yoga block underneath the head here. And we're going to straighten the bottom leg. Let the top knee and shin, or the top knee bend. The shin and the inner knee are going to rest on the floor. And we're going to do a quad stretch for the bottom leg. So bend the bottom knee, reach back with the top hand to find that foot. This is one of my favorite variations of the quad stretch because it doesn't allow cheating. And cheating on the quad stretch is when the knee goes forward or the thigh moves out away from midline. So this position doesn't allow that to happen. And the reason that's helpful is that one of your quadriceps is also a hip flexor. So 4 quadriceps attached to the kneecap. 3 of them, the top end attaches somewhere on the thigh bone. The 4th one goes up and attaches to that front hip bone. So when I was having you press on those hip flexors to see if they were engaging, that was one of them, your rectus femoris muscle. There's another 2-joint knee and hip muscle that attaches very close to the same spot. That's also a hip flexor, but it's not a quadriceps muscle. We're going to let this go, roll onto the other side. Make sure you support the head, no reason to strain the neck. Bottom leg straight to start. Top hip and knee are bent. The knee and the inner calf are resting on the floor, or block or blanket, something underneath there if that's more comfortable to you. We're going to bend the bottom leg, reach back with the top hand to find the foot for this quad stretch. Take a few breaths. And there's certainly many different ways to do the quadricep stretch. This is one of my favorites. If you are someone who has a tendency to be tense or tight in your hip flexors, or you feel a lot of low back tension and or pain, doing some of these hip flexor relaxation, these hip flexor stretches, being gentle can be helpful. The other self-care tool is some self-massage that you can do with foam roller for this quadricep, a muscle that goes up to that front hip bone. It's really a pelvic bone where it attaches. We're releasing this foot here and rolling onto our bellies. So we're coming into a couple of locust poses, which do not use your hip flexors at all. They use your hip extensors and your back extensors. I'm going to pad those hip bones here. And so opposing muscle groups to the hip flexors, arms down by the sides. Lengthen the tailbone towards the foot of the mat. You'll feel your pubic bone press into the floor. Those low belly muscles engage. Keep that. Inhale, lift the head and chest. Lift the arms. They actively reach towards your feet. Maybe you raise the legs here. Keep the neck long. And then exhale, lower down. We're going to do repetitions as opposed to holding. So we'll inhale, lift, head, chest, maybe legs, arms reach back, exhale, lower. 2 more. Keep the gaze down and forward so you're not hyperextending through the neck. Lower on down. You could bring your arms forward to rest the head. Maybe a little hip wiggle here. We're going to do that one more time. But you could decide, if I've had enough, I'm going to stay resting here. I'm going to do that same variation. Arms by the sides, palms face up, tailbone lengthening towards your feet. Inhale, lift the head, chest, arms reach, maybe a leg lift. Exhale, lower. 3 more. So we've done several things to release hip flexors and quads. Those would be the things that would inhibit you being able to come up and lift into this back bend. Come on down, arms forward, rest the head, bend the knees, rock the legs side to side. Rolling onto your back. Bring a yoga block with you, folded blanket, foam roller. I'm going to use my yoga bolster here. It gives me a little bit more elevation and it's softer, but you probably don't have a yoga studio in your arsenal. So I'm going to lift my hips and slide that prop, blanket, folded blanket, yoga block, foam roller underneath the hips. Make sure you're below back with this, on the back of the pelvis, right? Once you get in position, allow all the leg and the back and the butt muscles to relax. Breathe. Here's that lengthened breath again. We're in a mildly inverted position, meaning the pelvis is higher than the shoulders. So what this does for our spine is actually decompresses that lumbar spine even a little bit more than the legs up on the chair did, because now we have gravity actually working to create space between those vertebrae. So this could feel really good to your low back. You could stay with this. And we'll be in a similar position here as we stretch our hip flexors. So I'm going to pull one leg in, hold on to that knee or back of thigh. The other leg goes out straight. My heel is down. So I'm starting to open up through my right or whatever leg you have straight hip flexors here. And this might be enough stretch for you. Just the prop of the hips up and that leg being pulled down by gravity. I'm feeling a nice mild stretch through the top of my thigh here. starting a little bit into my abdomen. If I want to feel a little bit more into my abdomen, I'm going to do the leg lengthener exercise that we sometimes do in here. So the straight leg, I'm pushing my heel away from me, lengthening my leg out a little bit more, and then relax. You could do that again. Inhale, lengthen out that straight leg, pushing out through the heel. Exhale, relax. Maybe two more. Maybe you're just hanging out right there because gravity and the prop are enough. All right, we'll bring both feet down to the floor and just take a moment here, reposition if you need to. We're switching legs, other knee in, straighten the opposite leg, feeling a nice mild stretch. And sometimes mild to moderate sensation of stretch is actually better than making it intense. So you don't need to add this leg lengthener on if you're feeling enough here. So we're lengthen. I'm going to try to lengthen this straight leg. Inhale, press out through the heel. Exhale, relax. 3 more. And bring both feet back down to the floor. Notice how I never do this one with both legs straight. I bring one knee in, that tips the pelvis backward, so we get the hip flexor stretch on the opposite side. If I did both legs, then I just come into that big banana arch, compress through the low back, and all I feel is compression through my low back and no stretch through the hip flexor. So that's why we always do single leg, one knee always pulled in. We're going to take that prop out from underneath, coming onto your back. Maybe you hug the knees in, gentle rock here. Lowering the feet down to the floor. Cross one thigh over the other, pull the legs in, hold shins or backs of thighs, relaxing the shoulders. You could change this to the ankle over knee if you prefer that. If you come into the thigh over thigh and what you feel is pinch on the front of the hip, of the top leg, as opposed to stretch on the back or openness on the back side of the hip, usually that means your hip flexors are so tight, it's actually pulling the ball forward in the socket and you're getting that impingement of the hip joint there. Or there could be other reasons for that ball to be forward in the socket. Switching legs, other thigh on top. Relax your shoulders, the neck, the jaw. Letting this go here. We're bringing both feet to the floor. Knees are bent, feet flat, but bring your feet out wider than your hips, like yoga mat distance apart. This is going to be a spinal twist, but our hips, our legs are not going to be symmetrical. So you're not trying to stack your knees over each other. Bring the arms out to the sides. Drop both knees over to the right. So my right knee points towards the right, but my left knee is pointing towards the foot of my mat. And I'm starting to get this open is through the hip flexors in here. For me, this is enough. If you want to feel more stretch, take that right ankle, put it on the outside of that left knee or thigh to pull it down. Gaze could be up or turned away. So we've talked about the deep hip flexors that attach to the spine. We've talked about the ones that come up to attach to this front hip bone that are a two joint, the knee and hip muscle. That's 4. Remember I said there's 5. The 5th one is here on the front and side of the thigh. It's called your tensor fascia lata, and we're stretching that here in this position. It's another mouthful, so it's also, people call it the TFL for short. It's one of the two muscles that leads into your IT band. I'm going to bring the knees back up through center. Maybe hug the knees in, or a little happy baby, or some kind of reset before we do the other side. Bring the feet back down again. Feet are yoga mat distance apart. A little knock knee to start, and then drop both knees over to the left. This can be enough for you. Starting to feel these hip flexors stretching. I even feel those deep ones into my belly here as well. Or left ankle on the outside of that right knee and thigh. And remember, more is not always better. More stretch does not mean more release. More aggressive stretch does not mean more relief necessarily. Almost never, in fact. Usually it just makes you build more tension. Pull those knees up through center. If there's something you'd like to do here, maybe it's a happy baby, a different twist, a different hip stretch. Feel free to add that in before Shavasana, before relaxation. So as I was saying, I'm going to book in the practice in that hip flexor relaxation pose. You could do that if you'd like. We have been working and stretching the hip flexors, so it might be nice to put them in that off switch position. But you could also just set up in whatever pose feels best for you to be able to relax. So it could be the legs up on the couch or ottoman, legs up the wall. You might not be using any props here. Wherever you've chosen to be, make any adjustments you need to get comfortable. Maybe covering up with a blanket or a towel or sweater. Perhaps you close your eyes, using the breath to help us settle in. Take an inhale through the nose. Open the mouth, let out a sigh. You could do that again. Allowing your body to rest and let the breath go for the next few minutes. When you're ready, start to deepen the breath. You might invite some gentle movements, toes, fingers, ankles, wrists. Maybe you stretch your arms over your head and you inhale, lengthen through the whole body. Exhale, let it go from your back. Bend the knees and roll to your side. Pause for a moment here, perhaps taking this opportunity to appreciate your body, your breath, your yoga practice. Being gentle, press up to a seated position. Thank you all for being here and sharing your practice and energy. The light in me honors the light in each of you. Namaste.